Please like, share, and subscribe to help the channel grow. Thank you. Let's continue. The Jamaican environment, when local water sources are contaminated, waterborne illnesses like cholera become a severe and potentially fatal risk. Digestive ailments like norovirus can spread through contaminated water and food, especially in crowded conditions like shelters. The ceasefire is a critical step, but now we must urgently surge the immediate, consistent, and safe delivery of life-saving aid. Mercy Corps warns of escalating health emergency following Hurricane Melissa in Jamaica and Haiti. Mercy Corps is urgently warning of a public health crisis following the devastating impact of Hurricane Melissa on communities across Jamaica and Haiti, where flooding, power outages, and structural damage are straining health systems and hindering emergency response efforts. In Jamaica, hospitals, clinics, and pharmacies have sustained widespread structural damage, especially in the western region, including Black River and St. Elizabeth Parish. Many facilities have been forced to close, cutting people off from medical care or essential medications. Jessica Pearl, Mercy Corps' Caribbean Resilience Initiative Interim Director, says, "The risk of disease outbreaks like dengue is quickly increasing as stagnant water creates ideal breeding grounds for mosquitoes. Challenges with waste and sewage disposal also increase the risk of additional disease outbreaks. Access to clean water, sanitation, and mosquito nets will be critical public health priorities in the coming weeks." In Haiti, early reports of cholera and acute diarrhea in the Grand Anse and Southeast departments underscore the urgent need for clean water, sanitation, and medical assistance. Hurricane Melissa has pushed an already fragile health system to the brink. Intense rainfall, strong winds, and flooding have destroyed bridges and rendered many roads impassable, preventing the delivery of medicines and medical supplies. Contaminated floodwaters threaten to worsen the spread of waterborne disease in areas already struggling with limited access to safe drinking water. Mercy Corps teams in Haiti and Jamaica are already on the ground supporting local partners and authorities to address these urgent health risks by providing clean water and hygiene support, including distribution of water purification tablets, portable filters, water storage containers, jerry cans, and hygiene kits containing soap, detergent, sanitary pads, and baby hygiene items. Please like, share, and subscribe to help the channel grow. Thank you. Let's continue. Hurricane Melissa has killed at least 50 people across the Caribbean, a number that's likely to rise. But storms like Melissa aren't deadliest in the short days when they're active. Instead, it's in the weeks and sometimes years afterward, when affected communities struggle with a blocked road to the nearest hospital, a contaminated water source, or a local clinic with a missing roof and ruined equipment. Or perhaps a communal refrigerator that held insulin but is now damaged and its contents unsafe. In coordination with Jamaica's Ministry of Health and Wellness, Direct Relief's warehouse and logistics staff are currently packing an urgent shipment of requested medicines and supplies, valued at roughly $1 million wholesale. This shipment supplements aid Direct Relief had already positioned in the region before hurricane season began, and medical aid currently on the way. And its purpose is to head off what's commonly called the second disaster. Please like, share, and subscribe to help the channel grow. Thank you. Let's continue. Hurricane preparedness packs, including medications and supplies provided by Direct Relief, are distributed in advance of hurricane season in Haiti by local NGO Hope for Haiti. These critical supplies are on the ground and are currently in use in response to Hurricane Melissa. Photo courtesy of Hope for Haiti. Research is increasingly proving that this second disaster, a period of months or years after a natural disaster severely damages a community, is deadly. 64 Puerto Ricans were directly killed by Hurricane Maria in 2017, but a groundbreaking 2018 study conducted in the months after found a number of excess deaths above 4,000, about 70 times the cited death toll. About 1/3 of those deaths were caused by a lack of access to health care, as blocked roads and closed clinics kept people from providers and medicine.